People battle with hemorrhoid, but when it becomes serious, then you need to see a doctor, whether orthodox or alternative medicine doctor like Asiwaju ELEGBOOGI. When you talk about hemorrhoid, what are the things that cause hemorrhoid? What are the risk factors? How you can prevent hemorrhoid? These are the things we'll discuss in this talk. So we'll be talking about the causes of hemorrhoid, symptoms, how to prevent it, what to avoid, how to manage it, and we'll also give you some herbs that you can use to correct it if at the moment you are living with hemorrhoid. What are the causes? There's what we call inflammation, or there's an inflammation in your vessels around the anus. This could cause hemorrhoid. A lot of people, sometimes you see them going to the toilet. When they are trying to defecate, blood starts rushing out as if they are opening a tap. It is an effect of hemorrhoid. When the nerves are swollen or they are inflamed, what happens? There could be a burst, and when there's a burst, the blood comes out like you are opening a tap. Think about it yourself. When you open a tap down from morning to night, even the water in your tank could even get exhausted. So that is why you should not take for granted hemorrhoid when you see any of the symptoms. So what are the symptoms of hemorrhoid? I've talked about inflammation. I've talked about swollen vessel in the lower rectum. When a woman is pregnant, they are also at high risk of having hemorrhoid because during that time, their hormones, everything changes. From there, we now talk about the symptoms. Number one is itchy anus. So many people, when they go to the washroom, that you people call toilet, when they are defecating, they keep itching their anus. It is not an infection. A lot of people will start looking for antibiotics or infection drugs. No, these are not infections. It could be a symptom of hemorrhoid. And aside from that, you could see discomfort, poor bowel movements, blood coming out of your anus. When those blood come out, it is a clear symptom of hemorrhoid because there is an inflammation and there is a swollen vessel in the lower rectum. And aside from that, you also have what? Your anus coming out. So when it gets to the stage where your anus is coming out, then that is a prolapsed hemorrhoid. We have three types of hemorrhoid. We have the external hemorrhoid and the internal hemorrhoid. Then we have the prolapsed one. The external one is when you have when you have some swollen part at the tip of your anus, or something like flesh coming out from your anus. That could be an external hemorrhoid. We also have the internal hemorrhoid. The internal one is when the rectum is swollen or inflamed, and then we have the prolapsed one. The prolapsed one is when the anus, something like a ball, now coming out of your anus, that you have to push it in yourself. It's going to be very painful, It comes with a very level of high discomfort. If you now want to get rid of all these things, there are ways to get rid of them. If you want to prevent them, there are ways to prevent them. But what are the things that if you keep doing them, you are at high risk of having hemorrhoid? Is number one is indigestion. When you don't inject enough liquid into your system after eating, you might be at a very high risk of having hemorrhoid. Another thing is poor water intake. And another thing is excess beer. Those who take beer are at a very high risk of developing whether internal, external, or prolapsed hemorrhoid. And also those who take a lot of sugar. Sugar is not just you going to the market or buying sugar, cereals, or pouring it in your mouth. No. When you take a lot of carbohydrate, the byproduct of carbohydrate is glucose, which is sugar. So when you do that and you don't take a lot of vegetables and fruit, or also do exercise, you might be at a very high risk of having hemorrhoid. And another thing is pepper. You said that you should eat a lot of pepper. Yeah, pepper is good, but when it is too much, it's going to give you a problem. If you want to prevent it, just take a lot of water very well. Make sure you eat food and take fruits that will aid your digestion and easy bowel movement. And aside from that, reduce beer if you are the type that take beer. And you know that when you don't take beer, things will not work very well for you. Reduce the beer intake. And also cut sugar and cut pepper as well to the barest minimum, because these things would not help you when they are too much in your system. And also how to avoid it. The best way to avoid this is what I just tell you. And then the management. So when you now have this hemorrhoid, it can actually go totally, whether it is internal, external, or prolapse. They can actually go totally. So how can you manage or get rid of them, cure them totally, is what we are going to discuss here. So I'll be discussing this in Yoruba because I'm a Yoruba man and I'm promoting the Yoruba culture. So if you want to learn Yoruba, you can also look for a Yoruba teacher. Thank you. So you look for what we call ewe, iwere, njeje, ewe, agogo, igun, kon. This kon here is called potash in English. Pour everything together, grind it. You now pour it inside water extract from raw pap. We call it omidu in Yoruba. You pour everything inside it. When you do that, you are going to be taking 50 ml morning, 50 ml afternoon, 50 ml night. That means 150 ml in total in a day. So when you do that, the inflammation would go, number one. Number two, the pains around your anus, the itchy anus, everything would go. And the one coming out would also go in naturally without you pushing it into your system. For more content like this, follow us on Instagram, Twitter, Facebook, YouTube at Asiwaju ELEGBOOGI. Kindly share this video because when you do, you are helping a lot of people out there. Kindly follow us on Facebook, TikTok, Instagram, and YouTube at Asiwaju ELEGBOOGI.